Colposcopy of the cervix including upper/adjacent vagina. The physician examines the cervix, including the upper/adjacent portion of the vagina through a colposcope, a binocular microscope used for direct visualization of the vagina, ectocervix, and endocervix. The physician may insert a speculum into the vagina to fully expose the cervix as part of this procedure. Colposcopy of the cervix including upper/adjacent vagina, with biopsy, S, of the cervix and endocervical curettage. With biopsy, S, of the cervix. With endocervical curettage. The physician views the cervix, including the upper/adjacent portion of the vagina through a colposcope, a binocular microscope used for direct visualization of the vagina, ectocervix, and endocervix. The physician may insert a speculum into the vagina to fully expose the cervix as part of this procedure. For biopsy, an instrument is inserted in the vagina and used to take one or more small tissue samples of the cervix. For endocervical curettage, a small curette is passed into the endocervical canal, which is the passage between the external cervical os and the uterine cavity. A specimen is obtained by scraping in the canal with the curette. The instrument is removed. Colposcopy of the cervix including upper/adjacent vagina, with loop electrode biopsy, S, of the cervix. The physician inserts a speculum into the vagina to fully expose the cervix. A biopsy specimen of cervical tissue is removed by the loop electrode excision procedure, LEEP. LEEP uses a hot cautery wire containing an electrical cutting current as a cutting instrument. Due to the electrical current, a grounding pad is attached to the patient's leg during the procedure. Would it be appropriate to report code 57460 in conjunction with code 57505 during the same session? From a CPT coding perspective, it would be appropriate to report code 57460, colposcopy of the cervix including upper/adjacent vagina, with loop electrode biopsy, S, of the cervix, for the loop electrode excision procedure, LEEP, in conjunction with code 57505, endocervical curettage, not done as part of a dilation and curettage, for the endocervical curettage procedure because code 57505 is not considered to be an inclusive component to code 57460. Colposcopy of the cervix including upper/adjacent vagina, with loop electrode conization of the cervix. The physician performs a loop electrode excision procedure, LEEP. The physician inserts a speculum into the vagina to fully expose the cervix. The electric grounding pad is placed on the patient's leg and safety checks are run. The cutting current is set. Using a loop, the lesion is removed as one specimen. If the lesion is large and another pass is required, 2 equal specimens are removed and labeled for the axis of orientation. The same procedure is done again with a smaller loop if an endocervical excision is necessary. The bleeding vessels are cauterized, the vagina is inspected for any accidental injury, and the instruments are removed. Does CPT code 57461, colposcopy of the cervix including upper/adjacent vagina, with loop electrode conization of the cervix, include both conization and endocervical curettage or should individual codes be reported instead? Endocervical curettage performed at the same time as a conization of the cervix is reported with code 57461 only. The conization includes the endocervical curettage. Therefore, it would not be appropriate to report endocervical curettage and conization performed at the same operative session with separate codes for each procedure. Colposcopy of the entire vagina, with cervix if present. With biopsy, of vagina/cervix. Paravaginal defect repair, including repair of cystocele, if performed, laparoscopic approach. The physician performs a colposcopy of the vagina and the cervix, if present. The patient is placed in the lithotomy position and a speculum is inserted into the vagina. The vagina is inspected through the colposcope, a binocular microscope providing direct, magnified visualization of the vagina and cervix. The physician examines the tissue for discharge, inflammation, ulceration, and lesions. The cervix is exposed, cleansed, and inspected for any ulceration or lesions. Acetic acid may be applied to help enhance visualization of the columnar villi and any lesions. Colposcopy of the vulva. With biopsy, the physician performs a colposcopy of the vulva, the external genitalia region of the female that includes the labia, clitoris, mons pubis, vaginal vestibule, bulb, and glands, and the vaginal orifice. The patient is placed in the lithotomy position and the vulva is inspected through the colposcope, a binocular microscope used for direct visualization of the vagina and cervix. The bright light of the colposcope is directed so as to inspect the vulva and perianal area for any lesions or ulceration. In 56,821, a biopsy is taken of any vulvar tissue in question under direct vision. The number and size of the biopsy will depend on the lesions. Pressure is applied and hemostasis of the biopsy site is achieved.